Hey everyone! Welcome back to our channel. Today, we're diving into a topic that affects so many people but often flies under the radar: misdiagnoses. We all go to the doctor hoping for answers, for relief, for a plan to get better. But what happens when the diagnosis is wrong? It can be confusing, frustrating, and even scary for anyone. That's why we're here to talk about it in detail. We're counting down the top 5 commonly misdiagnosed medical conditions. You won't believe how often these happen and the impact they can have on patients' lives. So buckle up, hit that subscribe button so you don't miss out on future health topics, and let's jump right in. Coming in at number 5, we have celiac disease. Now, this isn't just about avoiding gluten. It's about your body mounting a serious attack on itself every time you eat something with gluten in it. See, celiac disease is an autoimmune disorder, meaning your immune system, which is supposed to protect you, gets confused and starts attacking your own body. In this case, it attacks the lining of your small intestine when you consume gluten, a protein found in wheat, barley, and rye. This immune system attack leads to damage in the small intestine, preventing it from properly absorbing nutrients from food. This malabsorption is at the root of many of the symptoms associated with celiac disease. And the symptoms? They can be all over the map. We're talking everything from the classics like diarrhea, bloating, and gas to things you might not expect like fatigue, anemia, even skin rashes. The real kicker here is that celiac disease often masquerades as other conditions. Many people are initially diagnosed with irritable bowel syndrome, IBS, or lactose intolerance because the symptoms can be so similar. Think about it: stomach cramps, bloating, changes in bowel movements. These can all point to a bunch of different digestive issues. This overlap in symptoms is a big reason why getting to the correct diagnosis can be tricky. And unfortunately, many people suffer for years, sometimes even decades, before getting the right diagnosis and proper treatment. Can you imagine feeling unwell for years, not knowing why, only to find out it was something treatable all along? That's why awareness is key. If you're experiencing persistent digestive problems, don't just brush it off as a sensitive stomach. Talk to your doctor, get tested. It could change your life. Now, the good news is diagnosing celiac disease is getting better. Blood tests can detect antibodies that your immune system produces in response to gluten. If those tests are positive, your doctor might recommend a biopsy of your small intestine to confirm the diagnosis. Early diagnosis is crucial because untreated celiac disease can lead to long-term health complications. We're talking about an increased risk of other autoimmune disorders, osteoporosis, even certain types of cancers. But here's the empowering part. Once you have a diagnosis, managing celiac disease is largely in your hands. By adopting a strict gluten-free diet, you can effectively manage your symptoms, allow your gut to heal, and prevent those long-term complications. So, if you suspect you might have celiac disease, don't wait. Talk to your doctor, get tested, and take control of your health. Remember, a proper diagnosis can lead to a healthier, happier life. Don't let celiac disease control you. Take charge and live well. At number 4, we have Lyme disease, an illness caused by bacteria transmitted through the bite of infected black-legged ticks. Now, not all ticks carry Lyme disease, and not every bite from an infected tick leads to the illness. But when it does happen, it can be a real problem if it's not caught and treated early. One of the tricky things about Lyme disease is that its symptoms can mimic those of other common illnesses, particularly the flu. Think about it: fever, chills, fatigue, muscle aches, headaches. These are all symptoms that could easily point to a nasty flu bug. And this is where the misdiagnosis often happens. People, even doctors, might dismiss the symptoms as just a passing flu, especially if they don't recall a tick bite. This is why it's so important to be aware of your surroundings, especially if you live in or have visited areas where ticks are common. Remember, early detection is key with Lyme disease. When caught early, it can be effectively treated with antibiotics. However, if left untreated, Lyme disease can progress to later stages, causing more serious and potentially long-term health problems. One of the scariest aspects of Lyme disease is the potential for long-term complications if it goes undiagnosed or untreated. Some people develop what's known as post-treatment Lyme disease syndrome, PTLDS, experiencing lingering symptoms like fatigue, pain, and cognitive difficulties even after the initial infection has been treated. Imagine dealing with debilitating fatigue that makes it difficult to get out of bed, persistent joint pain that limits your mobility, or brain fog that makes it hard to concentrate. This is the reality for many people living with the long-term effects of Lyme disease. And this is why we can't stress enough the importance of advocating for your health. If you've been bitten by a tick, especially if you live in an area where Lyme disease is prevalent, and you start experiencing those flu-like symptoms, don't just assume it's the flu. Be proactive. Talk to your doctor. Tell them about the tick bite. Ask to be tested for Lyme disease. Early diagnosis and treatment can make all the difference in preventing those long-term complications. Coming in at number 3, we have a condition that's often shrouded in mystery: fibromyalgia. Now, if you haven't heard of it, don't worry, you're not alone. Many people are unaware of this condition. It's a chronic pain condition that affects millions of people worldwide, but it often flies under the radar because it's frequently misdiagnosed or misunderstood. Imagine dealing with widespread pain throughout your body, the kind that just won't quit, no matter what you do. For people with fibromyalgia, this pain is a daily reality, a constant companion that never seems to leave. But here's the thing: there's no visible injury, no broken bone, no obvious source of the pain. It's like a ghost pain that haunts them. And that's what makes fibromyalgia so difficult to diagnose and even harder to live with. The invisible nature of the pain adds to the complexity. It's like your body is sending out pain signals, but doctors can't pinpoint the exact cause. The signals are there, but the source remains elusive. This leads to a lot of frustration for patients. They feel the pain, but the lack of a clear diagnosis can be disheartening. They know they're in pain, but without a clear explanation, it's easy for others to doubt their experience. This doubt can come from friends, family, and even medical professionals. And that's why it's so important to talk about fibromyalgia, to shed light on this often misunderstood condition. Awareness can lead to better understanding and support. Knowledge is power, and understanding the condition is the first step toward getting the right diagnosis and treatment. The more we know, the better we can manage it. Now, you might be thinking, okay, so fibromyalgia causes pain, but what else is there to it? Is it just about the pain? Well, the truth is, it's a lot more than just aches and discomfort. The condition affects multiple aspects of a person's life. Think about how you feel when you have the flu, that all-over achy feeling, the fatigue that just wipes you out. Now, imagine feeling that way every single day. People with fibromyalgia often experience this kind of fatigue on a daily basis, even after a full night's sleep. It's a fatigue that sleep can't seem to cure, and it doesn't stop there. The condition affects sleep quality as well. Imagine struggling to fall asleep or stay asleep, waking up feeling exhausted even after a full night's rest. This is a common struggle for those with fibromyalgia. That's another common symptom of fibromyalgia: sleep disturbances. The lack of restful sleep exacerbates other symptoms, and as if that weren't enough, fibromyalgia can also mess with your mood, causing feelings of anxiety or depression. The emotional toll is significant. So you can see, this condition really takes a toll on your entire body, both physically and mentally. It's a comprehensive challenge. It's like a domino effect. The chronic pain disrupts your sleep, the lack of sleep affects your mood, and everything just spirals from there. Each symptom feeds into the next. And because the symptoms are so varied and can mimic other conditions, it's no wonder that fibromyalgia is often misdiagnosed. The overlap with other illnesses complicates diagnosis. It's like a chameleon, blending in with other illnesses and making it tricky for doctors to pinpoint the real culprit. The condition can easily be mistaken for something else. So, what can you do if you suspect you might have fibromyalgia? How do you navigate this complex condition? Well, first and foremost, don't ignore your symptoms. Pay attention to what your body is telling you. If you're experiencing chronic pain, fatigue, sleep problems, or mood changes, talk to your doctor. Open communication is key, and be prepared to advocate for yourself. Sometimes you need to be your own best advocate. Remember, you know your body better than anyone else. Trust your instincts and speak up. Keep a detailed record of your symptoms, including when they started, how often they occur, and anything that seems to trigger them. This information is invaluable. This will help your doctor get a clearer picture of what's going on. Detailed records can make a big difference, and don't be afraid to ask for a second opinion if you're not getting the answers you need. Sometimes another perspective can be helpful. Finding the right doctor who listens to you and takes your concerns seriously is crucial. A supportive medical professional can make all the difference. It might take some time, but don't give up. Persistence is key in managing this condition. Remember, you deserve to feel heard and understood, and getting the right diagnosis is the first step toward managing your symptoms and improving your quality of life. With the right support, you can find ways to cope and thrive. Coming in at number 2, we have hyperthyroidism. Now you might be thinking, Dr. Mike, what even is a thyroid? Well, it's this little butterfly-shaped gland in your neck that plays a huge role in your metabolism. It regulates how your body uses energy, produces proteins, and controls how sensitive your body is to other hormones. And when it's overactive, it's like someone hit the fast-forward button on your body's functions. Everything speeds up, from your heart rate to your digestion. One of the telltale signs of hyperthyroidism is unexpected weight loss, even if your diet and exercise routine haven't changed. This can be quite alarming and confusing for many people. You might also feel constantly on edge, like your heart is racing a mile a minute, pounding in your chest even when you're just sitting still, even when you're just relaxing. This can make it hard to enjoy downtime or feel truly at ease. And speaking of sleep, good luck getting a good night's rest when your body's stuck in overdrive. Insomnia and restless nights become common. Now here's the tricky part. A lot of these symptoms, like anxiety and difficulty sleeping, can easily be mistaken for other conditions, such as generalized anxiety disorder or even the changes that come with menopause. This overlap can make diagnosis challenging. That's why it's so important to get the right test done if you're experiencing these symptoms. A proper diagnosis is key to effective treatment. So, how do you know if your thyroid might be the culprit? Well, apart from the symptoms we just discussed, keep an eye out for a few other things. These additional signs can help pinpoint the issue. Do you feel unusually sensitive to heat, like you're constantly sweating even when it's not that hot? This can be particularly uncomfortable and disruptive. Have you noticed any changes in your bowel movements, like going more frequently? This can be a subtle but telling sign. And here's a weird one. Have you noticed your hands shaking a bit, especially when you're holding something steady? This tremor can be quite noticeable and concerning. That's called a tremor, and it's another common symptom of an overactive thyroid. It's a physical manifestation of the internal chaos. Now, I know it can be a little awkward to bring up these symptoms, but trust me, it's way better to get checked out than to ignore them. Early intervention can prevent complications. Think of it this way. Your thyroid is like the engine of your metabolism. If it's running too fast, it can cause wear and tear on your body. If it's revving too high for too long, it can put a lot of stress on your body, leading to various health issues. This stress can manifest in different ways, affecting your overall well-being. Over time, untreated hyperthyroidism can lead to more serious problems like heart issues, osteoporosis, and even eye problems. These complications can significantly impact your quality of life. The good news is, diagnosing hyperthyroidism is usually pretty straightforward. A simple blood test called a thyroid panel can measure the levels of different thyroid hormones in your blood. This test is quick and informative. If your doctor suspects hyperthyroidism, they'll likely order this test to confirm the diagnosis. It's a crucial step in identifying the issue. Treatment for hyperthyroidism typically involves medications that help slow down the production of thyroid hormones. In some cases, radioactive iodine therapy or surgery might be recommended to reduce the size of the thyroid gland. These treatments aim to bring your thyroid function back to normal. The important thing is to work closely with your doctor to determine the best course of treatment for your individual needs. Personalized care is essential for effective management. Remember, you know your body best. If something feels off, don't hesitate to advocate for your health. Speak up and share your concerns with your healthcare provider. And ask your doctor about the possibility of hyperthyroidism. It's better to be proactive than to wait for symptoms to worsen. Early diagnosis and treatment can make a world of difference in managing this condition and preventing long-term complications. Taking action now can lead to a healthier, more comfortable future. And finally, the top misdiagnosed condition on our list is multiple sclerosis, or MS for short. This one's a real head-scratcher, even for experienced doctors. You see, Mississippi is an autoimmune disease that affects the central nervous system, which includes your brain and spinal cord. Now here's where it gets tricky. The symptoms of MS can vary wildly from person to person, and they can come and go over time. Some people might experience numbness or tingling in their limbs, while others might have vision problems, difficulty with balance, or even trouble speaking. This unpredictable nature makes MS incredibly difficult to diagnose. Imagine going to the doctor with fatigue one week, then blurry vision the next, and then muscle weakness the week after that. It's like your body's playing a frustrating game of medical mystery. Because MS affects the central nervous system, which acts as the control center for your entire body, the range of potential symptoms is vast. Some people experience fatigue so severe it feels like they're running a marathon just trying to get through the day. Others might have trouble with coordination, making even simple tasks like buttoning a shirt feel impossible. One of the hallmarks of MS is what's called relapse-remitting symptoms. This means you might have periods of time where your symptoms flare up, followed by periods of remission where you feel relatively normal. These unpredictable cycles can make it even harder to get a clear diagnosis. And to make matters even more complicated, many of the symptoms of MS, like fatigue, pain, and cognitive difficulties, overlap with other common conditions. So it's not uncommon for MS to be initially misdiagnosed as something like chronic fatigue syndrome, fibromyalgia, or even stress. The good news is, while there's no cure for MS yet, early diagnosis and treatment can significantly slow down the progression of the disease and help manage symptoms. That's why it's so crucial to advocate for your health if you're experiencing any unexplained neurological symptoms. If your doctor dismisses your concerns or you're not getting the answers you need, don't hesitate to seek a second opinion, preferably from a neurologist who specializes in MS. They can perform a thorough neurological exam, order specific tests like MRI scans, and help rule out other possible conditions. Remember, you are your own best advocate. Don't be afraid to ask questions, do your research, and keep pushing until you get the answers and the care you deserve. Early intervention can make a world of difference in living a full and active life with MS. So there you have it, the top 5 commonly misdiagnosed medical conditions. We covered everything from celiac disease, which can wreak havoc on your gut, to multiple sclerosis, which can affect your entire body in unpredictable ways. The key takeaway here is this: you know your body best. If something feels off, don't brush it off or ignore it. Talk to your doctor, ask questions, and don't be afraid to seek a second opinion if you're not getting the answers you need. Remember, early diagnosis and treatment are crucial for managing these conditions and preventing long-term complications. So be proactive about your health, advocate for yourself, and never give up on finding the right answers. If you found this video helpful, give it a thumbs up, subscribe for more health-related content, and share your experiences in the comments below. Thanks for watching and take care of yourselves.